New at 9, Oklahoma State University is preparing medical students to better serve rural areas of the state, which they say can be a medical desert.
OSU Center for Health Sciences was just ranked #1 in the country by U.S. News & World Report for the third year in a row for its work placing graduates in areas that need doctors the most. Fox 23's Paris Rain joins us live in studio. Paris, you talked to an instructor and a student from the Tahlequah campus about why it's so important to get doctors in these medical deserts.
That's right, I did, Nathan and Shay. It's a need that they say is growing here in Oklahoma, where 75 of 77 counties are considered healthcare shortage areas. And those who are a part of the OSU Center for Health Sciences say their mission is to hopefully change that. Oklahoma State University Center for Health Sciences, known as OSU CHS, is ranked #1 in the nation for placing graduates in health professional shortage areas, often called medical deserts.
If we look across Oklahoma, 75 of Oklahoma's 77 counties are HPSA designated shortage areas. If we look at that same data for mental health, all of Oklahoma's counties are designated mental health shortage areas. And what that means is about a third of Oklahoma's population is living in a county where we don't have an adequate supply of primary care physicians.
To address that gap, students don't just learn in the classroom. They train directly in the communities that need them most.
I think that it's a really unique opportunity for us as future physicians in our training to be able to train in these areas to get a realistic idea of what it's going to be like to serve these communities in the future, and then as well as just being equipped and trained even further so that we can keep them, with us before we have to send them to Tulsa or OKC for the specialist. Like, what can we do the most to serve them?
Fourth-year student Kelly Swank says the hands-on experience is critical, especially for students who don't come from small towns themselves.
That's why I've loved being here, is because I get to see that there is a deeper side to somebody than just their physical health. There is a mental component. There is a spiritual component. And as DOs, we recognize that to begin with, but being here and being immersed in the Cherokee Nation culture, we get to really experience that firsthand.
Dr. Bray says it's a long-term investment aimed at making sure more Oklahomans, no matter where they live, can access the care they need.
And those relationships with the communities, the relationships with patients that they build, is how we ensure that we have a sustainable physician workforce for Oklahoma. And more importantly, that patients and individuals living in our state have access to the care that they deserve. They have access to high quality care, and that they have physicians who are willing to listen to them and partner with them to achieve health.
While the #1 ranking 3 years in a row is a big deal, they say the real measure of success is whether more patients can actually get care close to home. They say that starts with training doctors where they're needed the most. Live in studio covering News That Matters, I'm Paris Rain, Fox 23 News.